Have you ever suffered from gallstones or know someone who has? Gallstones, those pesky little troublemakers, are more common than you might think, bringing discomfort into the lives of many. This video is your go-to guide for understanding gallstones and exploring the world of remedies. We'll delve into the details, shedding light on this prevalent health issue and the various ways to manage it. So whether you're a curious mind or seeking relief, this is for you. Stay with us to learn more about gallstones and how to manage them. Firstly, we need to understand what gallstones are. Now imagine you're walking on a pebbly beach. The stones under your feet are smooth, hard, and vary in size. Similarly, gallstones are hard, pebble-like deposits that form within the gallbladder. The gallbladder is a small, pear-shaped organ tucked under your liver on the right side of your abdomen. It's like a storage facility for bile, a greenish-brown fluid produced by your liver to help digest fats. After a meal, your gallbladder contracts, squeezing the bile into your small intestine. Now, gallstones, these hard particles, can be as tiny as a grain of sand or as large as an apricot, and some people may develop just one gallstone, while others might have several. Gallstones are primarily made up of two components, cholesterol and bilirubin. Cholesterol stones, which are usually yellow in color, are the most common type, making up about 80% of all gallstones. They occur when your gallbladder can't dissolve the excess cholesterol in the bile. On the other hand, pigment stones are small, dark stones made of bilirubin, which is a byproduct of red blood cells broken down by the liver. These stones form when the gallbladder doesn't empty correctly or if you have a liver condition that leads to increased bilirubin production. Sometimes gallstones don't cause any symptoms and are discovered accidentally during unrelated medical procedures. But when they block the bile ducts, that's when the trouble begins, leading to severe abdominal pain, nausea, and even jaundice. In essence, gallstones are like uninvited guests that decide to set up camp in your gallbladder. These hard particles are formed by the crystallization of excess cholesterol or bilirubin in your bile. And while your gallbladder is just trying to do its job of storing bile, sometimes things go awry, leading to the formation of these stones. So, gallstones are hard particles that develop in your gallbladder, but what causes them? Stay tuned as we delve into the causes and risk factors of gallstones in the next segment. Understanding the origins of gallstones is key to managing them. So, let's dive right into the various causes of these pesky pebbles. First off, a high cholesterol level in the body is a prime culprit. When your liver secretes more cholesterol than your bile can dissolve, the excess forms into crystals and then into stones. Just like how too much sugar in your tea will settle at the bottom, excess cholesterol does the same in your gallbladder. Next, we have high bilirubin. Bilirubin is a chemical produced when your body breaks down red blood cells. Certain conditions, like liver cirrhosis or certain blood disorders, can cause your liver to produce too much bilirubin. The surplus can then lead to gallstone formation. Thirdly, concentrated bile could also be a cause. If your gallbladder doesn't empty properly or often enough, bile may become highly concentrated, contributing to the formation of gallstones. Now let's talk about some risk factors. Obesity tops the list here. The reason? Well, obesity can cause an increase in the amount of cholesterol your liver secretes. It also hampers the gallbladder's ability to empty itself. Both these factors make obesity a significant gallstone risk. Diet is another key player. Diets high in fat and cholesterol and low in fiber seem to play a role in the development of gallstones. It's like providing the perfect environment for these unwanted stones to thrive. Lastly, genetics can play a part too. If gallstones run in your family, you might be more likely to develop them. It's just another instance where you can blame your ancestors for some of your problems. So there you have it. High cholesterol, high bilirubin, concentrated bile, obesity, diet, and genetics are all potential contributors to the formation of gallstones. It's a complex interplay of many factors, but understanding these can help in managing and preventing gallstones. Now that we know what causes gallstones, what symptoms should we look out for? Well, stay tuned to find out. Gallstones are not always symptomatic, but when they are, it's important to recognize the signs. Now let's dive into what these symptoms might look like. First and foremost, the pain. This isn't your everyday run-of-the-mill stomachache. It's a distinct, sharp pain that typically starts in the upper right or middle abdomen. It may start suddenly and rapidly intensify, sometimes within mere minutes. This pain can last for several hours, and it's often severe enough to send people to the emergency room. Another common symptom of gallstones is nausea, accompanied by, you guessed it, vomiting. This isn't just a one-off occurrence. It's a recurring issue that tends to crop up, especially after meals. But let's not forget about jaundice. If a gallstone exits the gallbladder and gets stuck in the bile duct, it can cause a blockage. This in turn can lead to the skin and whites of the eyes turning yellow. This yellowing, known as jaundice, is a telltale sign that something is amiss with your gallbladder or liver. Now, if gallstones are left untreated, they can lead to some serious complications. One such complication is gallbladder inflammation, also known as cholecystitis. This happens when a gallstone blocks the cystic duct, leading to a buildup of bile. This can cause the gallbladder to swell and become inflamed, which can be quite painful and may require immediate medical attention. Another possible complication is an infection in the gallbladder, bile ducts, or liver. This can occur if a gallstone blocks the bile ducts, leading to a buildup of bile. If not treated promptly, this can lead to a potentially life-threatening infection. Lastly, there's pancreatitis, an inflammation of the pancreas. This can happen when a gallstone blocks the pancreatic duct, which can lead to severe abdominal pain and other symptoms like fever, rapid pulse, and nausea. Recognizing these symptoms can help you seek treatment early, but what does treatment involve? Stay tuned, as we'll be exploring that in our next segment. There are several ways to manage gallstones depending on their size and the severity of your symptoms. Firstly, let's look at lifestyle changes. This often includes adopting a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats. It's also crucial to maintain a healthy weight, as obesity can increase your risk of gallstones. Regular exercise is another essential component, as it not only helps maintain a healthy weight, but also promotes overall well-being. Now let's move on to medication. If your gallstones are small and you're experiencing mild symptoms, your healthcare provider might prescribe oral medication. These medicines are made from bile acid, which can help dissolve gallstones. However, they may take months or even years to work, and the gallstones may return if treatment is stopped. In some cases, a non-surgical procedure called endoscopic retrograde cholangiopancreatography, or ERCP, might be used. This procedure involves a flexible tube with a camera on the end, which is passed down your throat and into your small intestine. The doctor can then use tools to remove the gallstones. However, if your gallstones are large or causing severe symptoms, surgery might be the best option. The most common type of surgery is a cholecystectomy, which involves removing the gallbladder. This is usually done laparoscopically, meaning it's minimally invasive. The good news is that you can live perfectly well without a gallbladder, as the liver can still produce bile to help digest food. In rare cases, doctors might use a procedure called extracorporeal shockwave lithotripsy, which uses sound waves to break up the gallstones. Remember, each treatment has its pros and cons, and what works best for you depends on your particular situation. It's also essential to note that these treatments are designed to manage gallstones, not necessarily cure them. Gallstones can recur, so it's crucial to continue with lifestyle changes even after treatment. Remember, it's important to consult with your healthcare provider before starting any new treatment plan. Gallstones can be a painful experience, but there are ways to manage them effectively. As we've journeyed through this topic together, we've unpacked the nature of gallstones, their causes, symptoms, and treatments. So let's take a moment to recap. Gallstones are hard deposits that form in your gallbladder. They are largely caused by a high cholesterol diet, rapid weight loss, and certain medical conditions. Symptoms can include abdominal pain, fever, jaundice, and in severe cases, complications such as pancreatitis. But it's not all doom and gloom. There are several treatments and remedies available, ranging from lifestyle changes to medical procedures. A healthy diet, regular exercise, and maintaining a healthy weight can go a long way in preventing gallstones. However, if you're experiencing symptoms, it's crucial to seek medical advice promptly. Your healthcare provider can guide you to the best course of action, whether that be medication, surgery, or other interventions. This journey of understanding gallstones is a testament to the power of knowledge and the importance of staying informed about our health. It's a reminder that while gallstones can be a painful hurdle, they're not insurmountable. So, don't let the fear of gallstones weigh you down. Equip yourself with the right information, seek professional advice when needed, and take control of your health journey. Thank you for watching. Remember, your health is in your hands. Stay informed, stay healthy.